Hello everyone. This presentation is on the Cheng Qi Tang, also called Major Order the Qi decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, the Cheng Qi Tang is classified under drain downward. A representative pattern is Yangming bowel excess with severe constipation, abdominal fullness, and focal tenderness. Important ingredients include Da Huang, Mangzio, Jiaxi, Hupo. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 61-year-old man with chronic constipation, atrial fibrillation, and hypertension. The current medicines are digoxin, furosemide, levothyroxine. This case gives a plausible reason to consider the Cheng Qi Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Da Huang plus oral drug absorption. The mechanism is strong laxation speeds intestinal transit and can reduce absorption of concurrently taken oral medicines. The clinical significance is moderate for critical drugs such as digoxin or levothyroxine. My management plan is separate dosing, and avoid using this formula close to essential oral medicines. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Da Huang/Mangzio plus furosemide. The mechanism is diarrhea plus diuresis can cause dehydration and electrolyte loss, especially potassium. The clinical significance is potentially high in older adults or patients with cardiac disease. My management plan is monitor hydration, renal function, and electrolytes. Stop for significant diarrhea or weakness. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is electrolyte loss plus digoxin. The mechanism is hypokalemia increases sensitivity to digoxin and can increase arrhythmia risk. The clinical significance is potentially serious. My management plan is avoid unsupervised purgation in digoxin users and obtain medical review if symptoms occur. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, the Cheng Qi Tang may be reasonable when the patient's presentation matches Yangming bowel excess with severe constipation, abdominal fullness, and focal tenderness. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.